Sit with masks or without?
Antimicrobial resistance is a leading global health and development threat and inappropriate antimicrobial use in livestock, and one of the leading causes of increasing antimicrobial resistance. It is against this backdrop that COVAB developed a tool to monitor and control antimicrobial use and antimicrobial resistance in livestock in low and middle-income countries.
The technology system, it is going to be on a computer-based, but also an app-based on the phone for the farmers. Is to connect farmers to drug shop dealers, technical people to support them with information, but also the system should be accessed by policy makers to assess the level of compliance, the level of use, so that they can make the necessary recommendations.
So my advice to the public is, one, do not use antibiotics unless they are prescribed to you by a healthcare worker. Also to farmers, do not give your animals antibiotics unless they are what? They are prescribed by a vet practitioner. Many of the healthcare workers that are prescribing antibiotics are not prescribing them. Many times they are prescribing them inappropriately.
Antimicrobial resistance occurs when some of the germs, bacteria, virus or fungus that cause infections resist the effects of the medicines used to treat them. This may lead to treatment failure or the inability to treat the cause of the infection. The project will be rolled out in Wakiso district and is aimed at mapping out the veterinary drug distribution chain and drug use in the district.
We should be what we call consumer aware sensitive. We should know what type of chicken we are eating, what type of meat we are eating, where has it been raised. For example, you should know that if animals are sick and they are treated, they are not supposed to be sold and consumed immediately. There is what we call withdrawal period for different drugs. You are supposed only to eat the meat or milk from that animal if it has gone beyond those days of withdrawal period, and mostly it is from 7 days and above. But today an animal is sick, it is injected, a farmer says that, oh, I'm likely to lose this animal, rushes and sells it to the market. Now for you, the consumer, you are happy to go and buy the what? Buy the meat. Especially these chicken which are sold in cages along the streets are very, very dangerous, because they feed them on antibiotics on a daily basis in water to keep them alive until they slaughter them for you. Those are very, very dangerous.
Scientists say that if left unchecked, by 2050, AMR may contribute up to 10 million deaths per year, with low and middle-income countries like Africa being victims. Story compiled by Zahara Abikaba.